Hello, hello. So, had a few technical difficulties. Apparently, I have to update my browser to get everything to work well. But today I wanted to hop on and start the series on pregnancy and postpartum care. Some of you may have noticed that we are working on a mini series. So, if you wouldn't mind giving us some feedback on what you would love to see or learn more about, and kind of where you are in the spectrum of understanding of what's going on during pregnancy and postpartum and what to expect, we'd really appreciate that. There's a link. I'll drop a link in the comment section to that quick little, it's like 5 questions, but it'd really help us out. So today I just wanted to talk a little bit about what to expect throughout pregnancy and what you can do when it comes to keeping the health of your pelvic floor working well and staying healthy and active. So first things first, all of the information that I come to you with is meant for educational purposes. It's not meant for individual diagnosis or to talk about individual medical issues. If you have individual concerns, let us know and we can talk maybe more one-on-one, or reach out to your medical provider and get some more guidance there, or we can help connect you with a medical provider that may be able to help you. So now that that's kind of out of the way, what I wanted to talk about today is, what to expect in that tail end of pregnancy, and how you can stay active and moving, even though you are having trouble just getting around with a growing belly. So what we see a lot is, as you get closer and closer to delivery, you'll start to see the pelvic floor, in theory, should start to relax a little bit, and the hip bones, the joints should start to relax a little bit and open to start to allow that baby to descend into the birth canal. And so how do you stay healthy and active throughout pregnancy? I think the biggest thing is to really just work your best to continue to move. Now, obviously, if you have a more complicated pregnancy or other medical concerns, definitely check with your healthcare providers. Reach out to a pelvic floor physical therapist or a physical therapist specializing in pregnancy and postpartum care, and your medical providers as well. So if you're getting chiropractic care or care with your midwife or OBGYN, check in and they may have some guidance for you as well. But staying active. So whatever you were doing before pregnancy, you more than likely can continue that for as long into your pregnancy as is comfortable. I think the biggest thing that we advise women to do is to be mindful of how you're moving your body. Just because you can do an exercise doesn't necessarily mean you should or need to. So maybe before you step into a more challenging exercise that was very, very easy for you prior to pregnancy, stop and think, okay, I could probably do this. I feel strong. I feel healthy. But look at the cost, risk, benefits. Is it beneficial for me and this growing baby for me to do this exercise? Is it going to give me a good reward as far as my health and fitness? Or is there more at risk if I jump into this exercise? And only you can really decide that, obviously, unless you're looking at bungee jumping or something like that, which I do not recommend. But all kidding aside, really being mindful about how you're moving your body. Sometimes towards the tail end of pregnancy, walking is honestly the only thing that may feel good for you. Just walking for 10, 15 minutes a day, a couple times a day. And that is, at least you're moving and staying active and staying healthy. And so also really thinking about working and engaging those core muscles, that is going to help support your spine and your back, but it's also going to help with the healing of the abdominal separation postpartum. So if you can maintain a healthy, strong core throughout your pregnancy, and really think about how you're moving your body, then your postpartum recovery should go a little bit more smoothly, if that makes sense. I get a lot of questions about diastasis. So that's this, or diastasis recti, the abdominal muscles up in the front, your big six-pack ab muscles. They come together and there's a connective tissue in the middle. And so what happens during the tail, like during pregnancy, is that connective tissue stretches and stretches to allow for that baby to grow and grow. So a separation is normal because otherwise the muscle would not be able to move, and then you would have even more challenges. So you're going to see a slight separation as the baby grows. The idea postpartum is that we should be able to, if you have good connective tissue and maintain a nice core strength and stability, that those muscles should come back together and still maintain a strength there. Sometimes what we see is a little bit of a separation, but you're still able to contract the muscles well enough that that separation is just more of an aesthetic thing and not necessarily a strength issue. But that's something you need to talk to your medical provider or a physical therapist about to assess your particular concerns. So during pregnancy, working on just really trying to contract all the way through the abdominal muscles as best you can, and then also being able to work on the pelvic floor in conjunction with that as well. So keeping the pelvic floor strong and healthy, but also learning how to relax towards the tail end of pregnancy, and then keeping the core strong and healthy as you progress through pregnancy. And there are lots of different ways you can do that. I think just getting some really nice guidance for your activity level and your particular concerns and where you want to get back to postpartum is going to be really beneficial. There's not a one size fits all exercise program necessarily. Every body is different. Every person is different. Everybody has different goals, and every pregnancy is different. So even if you have had a child before, maybe your second pregnancy looks a little different than your first. And then the other question I get is about C-section versus vaginal delivery and how do those recoveries differ. Obviously, with a C-section, it is a major abdominal surgery on top of the delivery of a child. So you're recovering from that, but also still working on recovering just from childbirth in general, depending on whether it was a scheduled C-section, emergency. Anyway, there's a lot that goes into it. But during a C-section, they go through quite a few layers of tissues to get to that baby. And so all of those layers have to have time to heal and come back together. And so what we usually advise women postpartum is once you get clearance from your doctor, and we work with them with your doctor or midwife or whoever is handling your pregnancy care, talk through what are the next phases for you. So a lot of it is scar tissue management, relearning how to connect with your core, which I talk with every woman about that. It seems to be a hot topic. How do I make my core stronger? So you're not alone. And then also just learning how to move again in a safe and healthy way to help support your healing tissues and help you continue to live your life, because just because you had a baby and a C-section doesn't mean you get to stop necessarily. So, you probably maybe have another toddler running around and a newborn that you've got to care for and a house to tend to. So, working on finding ways to incorporate a little bit of movement, a little bit of strengthening, a lot of breathing techniques is what I work on with women initially postpartum, because as you move through pregnancy, that baby starts to move and shift things around. And so relearning how the breath is really important. So that's what I'd like to do over the next few weeks, is just break down each one of those little topics. So talking about breathing, movement and exercise during pregnancy, how to stay active as long as possible, and how to avoid some of the back pain, hip pain that tends to come later stages of pregnancy, how to keep your pelvic floor healthy and strong and your core healthy and strong, and then how to start to recover postpartum to reduce the risk of some of the pelvic floor issues that I hear women having, leaking, with coughing, sneezing, jumping, that stress urinary incontinence, and pelvic pain that sometimes comes postpartum. And so relearning how to navigate all of that. So that's kind of the plan. If you've got questions about specific topics that you think would benefit this community, I'd love to hear it. Please just send me a message or comment, and we'll put together a short little snippet. And again, we are working on putting together an awesome mini course online. And the next couple of weeks, we'll be looking for about 10 people to run a beta test and give us some feedback so that we can make sure that we shape this course the best way possible for everyone. So if you're interested in testing that out for us and giving us some feedback, then send us a message and we would be happy to have you test that out for us. And like I said, we'll be looking for about 10 people. So we'll close it after we get the first 10 people, and we'll be running that one for free. So first 10 people, the course will be free for you. Anyway, I'm so happy that you joined us today and look forward to seeing you again next week.